Gynecomastia is a condition in which there is redundant fatty tissue or breast tissue in a man's chest. And so some men can come in and they just have a little bit of extra fullness. Maybe they have more glandular tissue, more breast tissue. Sometimes patients have fat of just extra fullness in the chest. And then sometimes I have patients that have had a major weight loss and they have extra skin. So if patients just have extra fatty tissue, a lot of times I can contour that just with liposuction and removing the extra fatty tissue. The challenge is breast tissue isn't easily removed by liposuction alone. So with gynecomastia, I sometimes pair liposuction with removal of the extra glandular tissue or the extra breast tissue. And that may require the use of an incision. And typically I'll put that incision right at the edge of the areola so the scar kind of blends nicely into the transition of the pigment from the areola to the chest wall skin. That allows me to really remove the redundant tissue and to contour and flatten the area of the chest. But you want to leave some breast tissue, you want to leave some fat underneath it so that you have a nice contour. If you over-resect, then you can leave patients with a divot or a saucer deformity where the chest wall then collapses, and that can actually look more unnatural or more disturbing than the fullness. For my male patients, typically I'll make an incision across the chest in a straight line to remove the redundant skin and fatty tissue. I'll remove the nipple and replace that as a free nipple graft a little bit higher. And the reason for that is because, for men, we want their chest to be flat. We want there to be minimal breast tissue. And we're not trying to shape the breast tissue. We're really trying to get rid of it as much as possible and just leave a foundation for a normal contour. After gynecomastia surgery, it can be, like I said, liposuction or skin removal. I want patients to wear a compression garment. For men, I tell them it's your super suit. It's your Superman suit, you're gonna put it on, and that's gonna help compress the area to help decrease some of the swelling and the edema and allow that area to really heal and contour nicely. Again, no heavy lifting for 6 weeks, but if it's just liposuction alone, then patients can get back to maybe some light or moderate exercise after about 3 weeks. So for patients that are able to go to the pool without a shirt on, or wear some of the more form-fitted shirts, feeling more confident. It's really exciting for men and for women just to feel more normal and feel more balanced.